The disease is generic and is very difficult to live with. My mom's friend, who I call Aunt Candy, found out she had the disease at the age of 7. I have also completed research on this topic. Cystic fibrosis has various symptoms, treatments, and a very structured lifestyle. The symptoms vary depending on the severity of the disease. Respiratory symptoms include wheezing, breathlessness, and lung infections. The reason why patients with cystic fibrosis have trouble breathing is because the thick mucus associated with cystic fibrosis clogs the tubes that gives air to your lungs. The digestive symptoms include greasy stool, constipation, and a lack of nutrients. Valerie M. Hudson, in her article, Cystic Fibrosis, How Leaders Can Help, published in 2002, states that patients with cystic fibrosis tend to have salty skin. Parents with children that have cystic fibrosis can taste the salt when they give their child a kiss on the cheek. Once these symptoms have been recognized, they should go to a doctor for further treatment. There is no cure for cystic fibrosis. The Mayo Clinic staff states that a patient with cystic fibrosis needs to be treated at a center that specializes in the disease. Antibiotics are used to keep infections out of the body and lungs. A mucus thinning drug helps one cough up mucus and thin the mucus in the lungs. Oral pancreatic enzymes are used to help the body absorb nutrition. My Aunt Candy found out she had cystic fibrosis at the age of 7. She is now 50 years old and has undergone several treatments throughout her life. The treatments include hard pats on the back to cough up mucus, medications, and breathing treatments. My Aunt Candy has never lost hope, and in her faith in Jesus Christ has stayed strong. Her prayers were answered, and she was healed through new lungs. In February 4, 2013, my Aunt Candy received a call that lungs were available. When she went to the hospital, they ran tests and found that the lungs were a perfect match. They began surgery at 12 o'clock and ended at 9 o'clock in the morning. When she woke up, she was able to breathe. The next few weeks were very painful for her, but she rejoiced in the miracle that God had given her. My Aunt Candy was able to go home 1 month later to be with her family. This is a picture of my Aunt Candy 3 days after her lung transplant. In the article, Defying the Odds by Sharon Lindsay, we see yet another miracle. Sharon was told by doctors that she would not live past the age of 2. She is now 33 years old and has run many wind sprints. She has also won medals for these races. Sharon says she lives every day as if it is a gift. Although treatments are important, they are only one aspect of the life of a patient with cystic fibrosis. A patient with cystic fibrosis has a very structured lifestyle. Nutrition is key for a person with cystic fibrosis. A person with cystic fibrosis tends to be malnourished and needs 50% more calories than a person that does not have the disease. Drinking lots of fluids will also help thin the mucus in the body. Exercise can strengthen the heart and the lungs and cause infections to stay away. Washing hands is also very important for a person with cystic fibrosis. It is also important for the family members of that patient to keep their hands washed at all times. Today, I've discussed the symptoms, treatments, and the structured lifestyle of a person with cystic fibrosis. Even though it is a very difficult disease, it can be managed through treatments and a very structured lifestyle. Thank you.